Thank you, sir.
Thank you. Srikant Shinde.
Thank you.
Because you, Dr. Kulomani Samal, because you are not speaking and you are not giving, you are giving the chances to the doctors.
Thank you, Honorable Chairman, sir. I wish to thank you for giving me this opportunity to express my views about the demand for grants on Ministry of Health and Family Welfare. First of all, I wish to congratulate the government for introducing Rashtriya Bima Yojana and making a provision of 100 crore. The scheme to provide health insurance cover to BPL population against the premium of just ₹12 is commendable. I also thank Honorable Finance Minister for proposing to establish 5 new AIIMS at J&K, Punjab, Tamil Nadu, Himachal Pradesh and Assam. The elevation of Department of Ayush into a full-fledged ministry is also a welcoming step. This will certainly help to accelerate the growth of Ayurveda, Unani, Yoga, Siddha and Homeopathy. The United Nations has identified the 21st June as International Yoga Day thanks to the efforts of our Honorable Prime Minister. This will again accelerate the popularity of yoga, which is India's proud contribution to the world. The Government of India has set the ambitious target of health for all. It is indeed a Herculean task for any government to provide healthcare to more than 1.2 billion people. There are bound to be shortcomings while achieving this target, but still one would not doubt the intention or integrity of the people behind it. However, if we do not make the necessary budgetary provision to begin with, then we are certainly leaving a major loophole in our very structure that is bound to fail. For example, against the projected outlay of 43,795 crore under National Health Mission, only rupees 18,295 crore has been allocated for the year 2015-16, which is way below the budgetary estimates of 21,912 crores for year 2014-15. This steep cut in provision is bound to happen an adverse impact on the effective implementation of existing scheme as well as launching of the new skills. Today, US is spending about 8.5% of its GDP on the health sector. One may argue that US is a developed country, but even BRICS countries like Brazil and China are spending about 4% and 3% on the GDP respectively on the health. And how much is India spending? Only 1.8%. We will not be able to strengthen our existing healthcare system as per global standard with such steep cut. We won't be able to build new primary health centers, sub-centers, community centers, thereby adversely affecting the rural and the tribal population. There is already 20% shortfall in the sub-centers, 23% in the primary health centers, 32% in the community health centers. We have less than 1 bed per 1,000 patients. Even Sri Lanka has thrice the capacity of India. While additional resources are needed to bridge this gap, the inadequate provision will only increase this gap. This will definitely hamper the rural health system. We have to improve the infrastructure in the rural sector as far as delivery of the health services are concerned. Today, doctors are not willing to work in the rural areas because of the poor infrastructure. Primary health centers and the district hospitals are in bad shape. These centers are not fully equipped. There is shortage of medicines. However, there is no proper accommodation facilities for the doctors and the paramedical staff who have been deployed in the rural areas. Safety is the another concern. Salaries of the government doctors are meager as compared to the private sector. Therefore, doctors today are not willing to go to the rural areas. Many state governments are forced to make it mandatory for the doctors to serve in the rural areas for the stipulated period. However, most of them get away by paying fines. So, if we really want doctors to serve in the rural areas, we have to create the right environment. For that, government have to make heavy investment in the creating this infrastructure. Taking into account this situation, Shiv Sena in Maharashtra under the guidance of Honorable Paksha Pramukh Uddhavji Thackeray has already started the telemedicine scheme, which is running successfully. Honorable Chief Minister has also praised this initiative. Telemedicine could be a blessing for the rural areas. However, there is zero provision for telemedicine in this central budget. This is the second consecutive year where telemedicine has been ignored. Prior to that, during 2013-14, a sum of only 15 lakh was provided. This is really unfortunate. India will require additional 4 lakh doctors by 2020. Our current doctor to patient ratio is 1:1700. Therefore, it is essential to invest heavily in training facilities. We must utilize our resources to upgrade existing medical training institutes, to set up new medical training institutes. Also, the training facilities for paramedic staff will also have to be sufficient numbers. Unfortunately, there is very little provision in this regard. On one hand, we are planning to upgrade medical colleges to increase undergraduate and postgraduate seats, but there is zero provision in this year's budget. There is also a scheme for establishing 58 new medical colleges attached with the district referral hospitals. Again, there is no provision for this. For strengthening nursing and paramedical services also, heavy investment is needed, yet the budget is silent about this. I would like to make a suggestion here. Earlier I had brought to the notice of this August House how doctors from the foreign medical degrees are jobless in India because they are not able to pass the so-called screening test, which is a foreign medical graduate. I am the alone speaker, sir. Foreign medical graduate examination. My humble request to the Honorable Health Minister to review the structure of this examination and set up such a system where we can avail the services of these 10,000 jobless doctors having foreign medical degrees. Another issue is that many schemes are summed in the National Health Mission for this year. Therefore, it has become difficult to determine the extent of which many important schemes will get funding or whether the funding will be adequate or not. For example, on one hand, there is a steep increase in number of cases of cancer and diabetes. There is no specific provision for national program for prevention of control of cancer, diabetes, cardiovascular disease. By 2030, Indian diabetes numbers are expected to reach 10 crore. One-third of the world's diabetic patient will be in India, and by 2020 we will number one in India in diabetes. This is a silent killer. Cancer is more prominent and visible killer with approximately 33 lakh deaths in 2014-15 due to this deadly disease. Therefore, there is a great need to concentrate our efforts on containing the spread of diabetes and cancer. Similarly, there is no provision for national program for healthcare of the elderly. Honorable Finance Minister has proposed additional tax benefits for senior citizens as far as the mediclaim and the spending on the medical treatment is concerned. And I welcome that. But however, these measures are not sufficient. There is tremendous pressure on the tertiary care institutes like AIIMS and AIIMS-like institutes. This pressure is going to increase further because with the steep cuts in provision, we won't be able to upgrade and strengthen our district hospitals. These hospitals will not be able to cater the need of the specialty department. In fact, implementation of the free drugs and free diagnostic scheme will also be severely impacted. The central government has left this scheme upon the state government. The state government are not in position to fund this ambitious scheme. Therefore, it is my sincere request to the Honorable Finance Minister and Honorable Health Minister that we really want to achieve the target of health for all, then the central government must take it upon itself to implement this much needed program. It is important to ensure the availability of the medicines. Only 1 minute. Medicines at the cheaper rates. This is where generic drugs come into practice. It should be available mandatory at every drug store to keep the generic drugs and let the patients have the freedom to decide which drugs to buy, generic or the branded. In fact, though the government of India has been saying there will be a greater devolution of states as per 14th Finance Commission, the states are battling with their own set of problems, drought, unseasonal rains, farmer suicides. States like Maharashtra and Uttar Pradesh are expected to shoulder the burden of 6 sugar mills, which are unable to pay FRP to the farmers. Therefore, assumptions or expectations from the states that the states will make investment in the health sector will prove to be unrealistic. Though private sector has scaled up the investment in Indian health sector.
Please conclude.
Concluding, only 1 minute.
3 AM Srinivas.
1 minute, last point. Last point.
Within 1 minute.
नहीं ऐसे नहीं होता है ऐसे नहीं.
Only 1 minute.
Please conclude.
Last para is
Last para. वो डॉक्टर है वो. डॉक्टर है.
Thank you, sir. Though private sector has scaled up the investment in India health sector in the last year, the government has still a lead role to play simply because private health facilities are out of reach of the common man. Therefore, in case of private hospitals also, government need to regulate the exorbitant treatment charges by the private hospitals. If the electricity sector can have regulator, education sector has regulator in some states like Maharashtra, then why not regulator for an important sector like health? Providing healthcare is a social obligation and will remain so for the developing countries like India, where almost 30% of the population still lives below the poverty line. Therefore, I request the Honorable Health Minister to rigorously pursue with the Honorable Finance Minister for increase the allocation. I sincerely request the Honorable Finance Minister to raise the budgetary allocations of the...
Right. Please, Srinivas Rao.
Thank you. Thank you, Speaker sir, for giving me this opportunity.